It's long been said that too much sugar is bad for your health, but a team of American researchers now says the refined sugar is a lot more dangerous than you might think. A commentary published in the journal Nature suggests that sugar is public health enemy #1, that it contributes to millions of deaths from diabetes, cancer, and heart disease. Here's the thing, though. The journal goes on to say that sugar should be controlled, regulated, and taxed like alcohol or cigarettes. I want to talk to CBC medical specialist Dr. Karl Kabasele about that, and he joins me live here in Toronto. First of all, let's go back to the journal itself. I know lots of people have been writing in since this came out yesterday afternoon. Researchers saying sugar is public health enemy #1. Why are they saying that now?
Well, Carol, I think sometimes you really have to overstate things to make a point. But what they're saying is that we're still sort of understanding the impact of sugar and the role of sugar in the context of the foods that we eat on our health. But we do know that there has been obviously an association between overconsumption of sugar and obesity or overweight. There's also evidence that there may be an association between sugar consumption and blood pressure and your blood cholesterol and other markers or risk factors for heart disease. And there's also the idea that sugar can interfere with the hormones that control whether you feel satisfied after you eat and whether you feel hungry. So all of these things put together make it potentially a very potent agent in affecting our health.
They're not talking about all sugars. I mean, as I said, it's refined sugar. What exactly are they talking about, Dr. Karl?
Well, that's right. The fact that, if you eat an apple a day and there's some natural, fruit sugar in the apple, that's fine. What they're talking about is all of the added sugars in a lot of the products we consume. So we're really talking about processed foods and sugar-sweetened drinks. And if I could just show you something, we talked about this last year, but here, this is a glass full of sugar. It's 26 teaspoons. This is the equivalent of what the average Canadian consumes each day. If you can imagine, 26 teaspoons of sugar. Clearly, that's a lot. That's like about 20% of your caloric intake for the day. So the issue here isn't so much, whether sugar is good or bad, but we're just taking in too much of it.
Where do we take in too much of it? What are we eating such that we get 26 teaspoons of sugar a day? I know everybody knows pop is really bad for you in that regard.
Yeah, so pop, soda, that's an obvious one that people think of, but when you look at some of the fruit drinks and the sweetened drinks and the sports drinks that you may consume, when you look on the ingredient list, oftentimes you'll see sugar, fructose, corn syrup. These are all different forms of sugar that are added to products. And then also processed foods where you might not expect there to be a lot of sugar because they're not necessarily considered to be sweets, but they're just added for flavoring or to preserve the product or what have you. So I think the bottom line here is we really need to be reading labels and to be aware of how much sugar is in our food.
Do you think there's enough proof out there to suggest that sugar, is linked to diabetes, that it's linked to cancers and all of the things that this article talks about, such that we need to really interfere in people's lives that much to tell them what they should and shouldn't be eating?
I think the evidence is evolving, and the research is telling us, showing us connections between these various risk factors for health. Now, whether that means that we should be intervening or government should be intervening, I think what this article is telling us or is saying to us is that public policy is just one of the tools that we should be using in a global strategy to try to control the amount of sugar that we consume. And that other strategies include, educating the public, encouraging the public to read labels and to be aware of what they're eating, and also to be mindful of what kids are consuming and the kinds of advertising that's targeted towards kids. All of these things put together, I think, will help us to have a more reasonable intake of sugar.
It's interesting because Hostess, who makes Twinkies and a number of other sugar-laden cakes, has filed for Chapter 11 bankruptcy protection. Maybe that's a signal that a lot of people are reducing their consumption of these sugar-laden treats.
Well, I guess it's a possible factor. I think people in general are becoming more aware, and I think, you know, as the article suggests, where governments can be helpful is to sort of work behind the scenes, to limit the amounts of sugar that are in products, and to compel companies to be more forthcoming with information as to exactly what's in the products. Because I think if people were more aware, they'd make better choices.
All right. CBC medical specialist Dr. Karl Kabasele, thanks for joining me live in Toronto.
Thank you.